Um, so what we're going to be doing today is sort of a special training that I've created for a number of agencies in the last couple of years, which is to connect safety planning and seeking safety. And I hope that most of you had the opportunity to join me for the past 8 weeks. So this is our 9th week together. Two reminders with this is that, as always, you'll get the PDF of the PowerPoints. And I'm presenting Grand Rounds on Friday. It's not going to be about integrating safety planning with seeking safety, but it's going to be about safety planning. So for those of you who know of people who couldn't join these webinars, feel free to let them know. And as is typical, you'll get continuing education credit. The last thing to tell you is, unfortunately, I have a 10 o'clock training with another group, so I'm going to sign off just a little bit early. So today what we're going to do is review the overall framework for safety planning, and then review the framework for seeking safety, and then connect the dots. So what I'm going to do is go through the format of safety planning and show how all these different topics and modules and handouts and techniques that come from seeking safety totally align with safety planning. And then my hope is that on your own, you can create a case example that shows how you can link the two. So as you know, you're going to get all these slides as a PDF. So I'm going to whiz through a lot of the stuff that's review and really focus most of our time on connecting both seeking safety and safety planning. So as you remember, seeking safety, evidence-based, focusing on the co-occurring issues of trauma and PTSD and substance abuse initially, and now it's much more of an all-embracing kind of treatment. It's very flexible, very adaptable, as you know. That is for anyone with significant mental health challenges. Doesn't have to necessarily fall into the category of trauma and stress disorders, and substance abuse, dependence, and addiction. No exposure to significant trauma memories, as you remember, and the emphasis is on practicing of new behaviors and coping skills to further enhance people's sense of security and safety. How the problems of mental health challenges, trauma, PTSD interact with substances, and like we've talked about many times, that unfortunately they link in sort of a vicious cycle where one facilitates the other as far as risk and increasing the chance of harm, and as opposed to reducing risk, enhancing recovery. And there are 25 topic areas, and like we've talked about, the ones that, if you have limited time, are the first few. Safety is, what does safety mean to you? And safe coping skills. PTSD, taking back your power, is about all the ways in which trauma and abuse manifests itself in mind and body and relationships and community. When substances control you is the same kind of idea about what does misuse, abuse, dependence, withdrawal, tolerance, intoxication, and addiction, and with urges and cravings, what does that all look like in person? And how they interact with each other in ways which, unfortunately, substances can create more vulnerability, more exposure to people who may be manipulative, abusive, traumatizing, and controlling, and that in order to alleviate some of the symptoms of PTSD, people start to use substances and then may develop tolerance and withdrawal and dependence. And it also, again, puts them in a more vulnerable position because their ability to be vigilant about danger and protect themselves from danger, their impulse control is heightened in a negative kind of way, and their ability to protect themselves and to seek out healthy relationships is also hampered. So in all ways, they interact in ways which one makes the other one worse. And then we talked about the key aspect of detaching from emotional pain, dealing with urges and craving, re-experiencing through grounding and centering exercises, and then talking about asking for help. And asking for help is knowing who is safe and enhances your recovery versus who is dangerous and endangering, and who promotes your risk and your harm. So you only ask for help from safe people, and how to ask in a way which doesn't overwhelm the other person is something that's within their capacity to do, so that you don't meet rejection and abandonment and further your sense of despair and pessimism. Taking good care of yourself is about self-care and self-management, basic needs, compassion for self and for others, red and green flags, like we'll talk about, very important in safety planning, which is how do you identify situations and relationships and circumstances and environments where you plummet down, red, stop, danger, avoid. And remember, one of the issues with seeking safety is avoid avoidable suffering. Not all suffering can be avoided or can be understood to be dangerous at the time. But when you know that something is endangering of you, how to avoid it. And that relates to, later on, you'll see setting boundaries in relationships, how to set distance from people who are endangering and open yourself up cautiously, judiciously, but with a sense of trust and understanding to people who really have your best interests at heart. And then honesty is being honest with yourself about what's going on. And recovery thinking is a cognitive behavioral kind of issue of looking at how to not have the kind of distorted thinking that has you feeling helpless, hopeless, worthless, that screens out, or in cognitive therapy terms, selectively abstracts all the negative from the positive or the neutral. How to interpret things that are safe, that engender trust, that promote recovery, to further your sense of being attached to value, meaning, and purpose in life. Commitment is making a commitment to yourself and others, creating meaning, because like we've talked about, recovery is not the absence or the reduction of signs and symptoms. It's the restoration of purpose and value and meaning in life, and the understanding that you are a person of worth and that you have something to give yourself, and something to give others, and something to give the larger world. Community resources, setting boundaries in relationships, we just talked about. So discovery means not giving up, not getting stuck, always thinking of alternatives, finding a way to get others to support your recovery, coping with triggers. And as you remember, the asterisk is there because what we want to talk about is what are the precipitating factors, the environments, the activating factors, the things that happen that put you in a place where you re-experience trauma that you've had before, where you're more vulnerable, where you're encouraged to self-harm as opposed to encouraged for self-care. And we avoid the word triggers because of its connection to firearms, knowing that firearms have been used to control people in abusive relationships, and that firearms, of course, if you make a suicide attempt, you are much more likely to die from that attempt if you use triggers, firearms to kill yourself. Respecting your time is basically pleasant or pleasurable activity scheduling or time management, is that every day you can make the decision of how you spend your time. So respecting your time means to put your energies and how you schedule yourself and what you do towards recovery, as opposed to plummeting down in that red flag kind of spiral. Healthy relationships, for a lot of people, like we've talked about, unfortunately, they never had the experience of what a healthy relationship looks like. So part of this is distinguish dangerous relationships versus healthy relationships, and saying yes to all the signs that tell you that this relationship is something to be nurtured and supported, and that person is nurturing and supportive of you, versus dangerous relationships where, again, you set boundaries to distance yourself from danger and protect yourself. Self-nurturing is very much related to taking care of your basic needs, as well as compassion for yourself. Healing from anger and feeling from disappointment is really important. So those are the modules of Seeking Safety that we've reviewed. And again, the focus in Seeking Safety is on the first stage of healing, which is safety, as opposed to mourning the move from shame and humiliation that you experienced and the loss of what you had hoped for your future, to a future filled with dignity and virtue, meaning, purpose, and value. And then reconnection with joy, productivity, generativity, connecting to the outer world. So now I'm going to, now that we've briefly covered Seeking Safety, I'm going to move towards, again, affirming this, that you develop a commitment, you master your coping skills, you utilize safety planning, which we're going to move to very shortly, report your unsafe behaviors, and utilize the safety contract. So the focus is on safety skills. Now, I wanted to talk about this, is that the way in which both Seeking Safety and safety planning is administered is key to their success, to their efficacy. And so what we find is that it's very important to have a therapy, go back to that, that is collaborative, co-created, where the decision-making is shared, where the person is treated as a person, as a whole human being with many aspects. The person is not pathology. The person is not a diagnosis or a disorder. That instead of being clinician-generated or expert-driven, this is a therapy where the person is the expert on themselves, and they teach us who they are and what's important to them. So all those factors are the way in which we administer Seeking Safety and safety planning. And if you just hand people the handouts from Seeking Safety and you tell them what you're, in your expert opinion, is best for them without learning who they are, working with them, it doesn't work. The engagement doesn't work, they don't follow up, and the handouts are too generic to be meaningful to them. And they also feel in a one-down, worthless kind of, helpless kind of position where you become their foundation that they depend on, as opposed to that they can depend on their own inner resources that you help coach and mentor and support. Same thing with safety planning. So the way in which you do that, and this has been studied when people do safety planning through apps or online without any kind of relationship with another human being, another provider, that it doesn't have the same effectiveness at all. So it's really important how to implement these therapies, not just their content. And the format, again, check in some kind of quotation to set the theme, the topic, reviewing the handouts, looking at everybody's creativity, their alternatives, what speaks to them, practicing, rehearsing, and like I've suggested to you in the behavioral rehearsal and role play, that you play, or another group member in this case, plays them so that they can observe themselves in interaction, as opposed to be immersed in who they are and not really pay attention in a metacognitive way, that they can observe themselves so they can look at what to do differently, to speak more on their own behalf. And like I said, a key part of the check-in is, what safe coping skills have you done? Which indirectly suggests to people that they have good coping skills as well as bad. that they do those all the time, and that they have done it in the last week, where a lot of people who are mired in feeling victimized, demoralized, depressed, feel that they have never done anything on their own behalf and that they're helpless. We're always looking at all the windows of opportunity for all the ways in which, even in small incremental steps that build to larger kinds of improvements, they're always acting to some degree on their own behalf to protect themselves, to take care of themselves. And then, as always, with any of these time-effective therapies, we don't settle there when they've settled on a plan. We talk about all sorts of obstacles and challenges and barriers that may come up, brainstorm further to find a plan that they know that's within their capacity to do, that they're motivated to follow up, that's relatively simple, it doesn't call on a lot of extra resources, and has answered any kind of practical barriers and challenges, so they have the sense that when they make a commitment to do it, it'll actually happen. And then when we check out, like in safety planning, our last step, as you'll remember, is in our discussion today, what is the main thing that you took away to promote reasons for living, to have a sense that you can move on in the future? And in seeking safety, it's what did you learn about how to practice safe coping skills, where you feel more secure, more safe within yourself and in community with others. So these are what all these slides are about: the core concepts, the framework, the therapist tasks, and the process that we've talked about. Now, seeking safety and safety planning. Here's where we're going to spend the bulk of our time. But before I do, are there any questions about my brief overview of seeking safety before I link the two? If I don't see anything in the chat, I'll assume you're all good. Okay, so a safety plan is a personalized, prioritized, practical list of coping strategies and sources of support that can help people avoid dangerous situations and know the best way to react when they are in danger. So seeking safety involves safety planning. Here's all the ways in which they do: case management, safe coping skills, grounding and centering, detaching from emotional pain, which is very helpful, like I mentioned earlier, for urges and cravings, for the experiencing of trauma, the whole idea of when substances control you, and that aligns very much to lethal means access and lethal means restriction. Asking for help, like I mentioned earlier, taking good care of yourself, compassion for yourself. Red and green flags is very much part of what are warning signs, which is the very first step of the safety plan, following commitment. Creating meanings that are healing and recovery, which is essentially reasons for living. Community resources, which is part of the safety plan. Setting healthy boundaries in relationships. Discovery to stay open to experiences and new knowledge, which is the optimistic idea that change is always possible, that there's always a different, better way to do things, that you're never stuck, there's always another way to get unstuck. Think out of the box, do something different. How to get others to support your recovery, which is how to identify people who are dangerous to you, safe for you, and how to ask for help in a way in which you're more likely to enlist their support. Coping with all the situations that make you more likely to self-harm, to re-experience trauma, to impair your judgment, to put you in a vulnerable place. So how to change the people, places, and things so that your environment is more safe and more secure, respecting your time, that recovery is a need, just like a basic need of food, clothing, and shelter, what healthy relationships look like, and how to have compassion and self-nurturing for yourself. Now, safety planning. As you remember, It's a stepwise way of looking at how to enhance reasons for living, diminish reasons for dying, look at all the ways in which you act on your own behalf, moving yourself towards safety, and all the ways in which you don't, that you want to find another way of coping for the problem that you have. And the problem for a lot of people in these circumstances is significant, catastrophic, chronic kinds of traumatic, abusive experiences where they feel impaired and they feel that the only way to cope with that is to use substances which impair their judgment but pull them out of that situation, or to use substances which artificially create a sense of energy and interest and pleasure as a way to distract themselves from the pain, or self-harm in a more direct way, where people feel so hopeless about the present that the only escape that they have from that misery is something along the spectrum of suicide. So this is all to give people an idea that there are a vast array of ways to cope with overwhelming difficulties and challenges that promote their own security, self-compassion, and safety. And the very first step for that is recognizing warning signs that a crisis may be developing, that they may be at a weakened, depleted kind of state where typical life events become more overwhelming to them. This is not waiting until the crisis is very much at hand, when you're totally overwhelmed, what to do. Like a warning sign, this is a signal that things are not going in a good direction and you need to do something different. And the way that I found that's really helpful, and it could be because I started out in pediatrics before I moved to child psychiatry, so I had this medical model, is it's the same thing for somebody who has any kind of chronic illness, where they know that they need to check in with themselves about the warning signs that they have in their body that things are going out of control. So diabetic knows what ketoacidosis looks like, what hypoglycemia looks like. They know when their sugar's out of whack. So they know how to check their blood sugar to find out. They know what precipitates both of those having too little or too much. And they know who to consult with them. Same thing with somebody with asthma. They know when they take their maintenance meds or they don't need meds at all, and when they need to take their breakthrough meds, or people with migraines, when they either take no medicines or when they take breakthrough medicines. Everybody has sort of a sense of a warning kind of situation where the crisis may be at hand, but they want to avert the crisis. Same thing like with COVID now, where you know basically a lot of the symptoms of COVID, and it could be allergies, or it could be nothing, or it could be that the fever is barely perceptible, but you want to be cautious, so you'll get a test for yourself. You'll make sure that you haven't been exposed. You'll take the appropriate precautions. That's what we want to do in safety planning. So it could be that somebody has difficulty sleeping because they're having ruminative thoughts. So they're not exactly re-experiencing. They haven't gone into full flashbacks, but for a variety of reasons, they're starting to think about, oh, well, all people really, in the end, abuse me and harm me. There's no hope. That's a warning sign. They feel overly reactive and angry and irritable, or overly sensitive to rejection and abandonment and criticism and negative judgment. And they realize that that's a sign that they're overreacting to a situation. And if they don't do something about that, they'll push away good people and welcome in bad. So recognizing warning signs is the very first step. And then the next step is looking at all the things that they can do on their own behalf. Because for helpless, hopeless, worthless people, the worst thing that we can do is say that there's nothing that you can do on your own, that you have no capacity to take care of yourself. Let's start with all the ways in which other people can step in, including professionals like us, to take care of you. So we want to emphasize all the ways in which they've always acted on their own behalf. They've done the best. They've wanted to, in a lot of ways, preserve their sense of dignity and value and self-worth. How do we selectively ourselves look for that? Look for hope and potential and possibility, as opposed to focusing solely on pathology and deficits and disorder and diagnosis and disease. So we want to focus on my own coping strategies that take nothing, no extra resources, no reliance on other people, no special kinds of equipment that they need. It can all be done very simply. Then, if that answers most but not all of what they need, we encourage people to then look to friends, not for problem solving, not for advice, not for guidance, not for tangible support like getting into appointments, but just for connection, for distraction, for neutral or pleasurable activities, going out on a hike, joining them at a support group, volunteering for an agency, for walking their dogs, whatever it might be that pulls them out of a re-experiencing negative, hopeless, helpless, worthless, despondent, suffering kind of place to some place that's just neutral, if not joyful and pleasurable and fun. If that doesn't satisfy their sense of despair, re-traumatization, pessimism, then we urge people to look at, within their own natural supports, friends, family, community kinds of supports, church care committees, walk-in centers, people that they can contact who may help them resolve a crisis, who have good head on their shoulders, who give good advice, who very much they know from past experience can see them clearly and offer support of the kind of support that's meaningful to them. After all of that, what you do on your own, what you do with a friend, what you do to tell someone what's going on with you who's not a professional, who can give you all the kind of guidance and support that you may need to move forward. If that's insufficient, then we talk about contacting all of us, mental health professionals and agencies. That is not the very first step in a safety plan. That's after we've reinforced and explored in a very creative, if not even joyful and playful kind of way, all the things they can do on their own, all the natural supports, a lot of which they might take for granted, people that they meet when they're out walking their dog or out taking a hike, when they're shopping, or when they go to the same place to get coffee, whatever it might mean, all the people who add a little bit of consistency and security and safety and pleasure in their life. And like I've talked about, this can be with people who have chronic homelessness, where it feels like they have no connections and no safety, but they know what corners and what parts of the city are safer to them. They know that there's certain people that they would never check in with to like watch their dog or give them advice about what's a good food bank to go to, because that person is too violent, labile, volatile. They always have somebody, we always have somebody in our environment that's a helper as opposed to a herder. So looking at that, and then the vast array of mental health professionals, which is not just a number of a hotline. There's warm lines, text lines, There's peer support groups. There's community support groups like AA and NA groups. There's walk-in crisis centers. And then there's, if they've met with us, we have our own resources, crisis intervention, treatment, emergency support, aftercare, who's on call if we're not available, that vast array. So when we've gone through this, we've helped people identify the warning signs that a crisis is impending, what they can do on their own, what they can do with others, how they can enlist others for guidance, support, counsel, practical support, tangible support, then all the things that we have to offer. And in New Mexico, just like all the other states, when we're moving to the 988 emergency number, we now have this ability to connect all the crisis services that we have by calling a toll-free number. Then at that point, we talk about how to make the environment safe. And like we've mentioned before, the reason that we time it in this kind of fashion, we don't do it in isolation of all the rest of it, and we don't do it at the start, is because we've now given people a lot of tools, things they can do on their own, things they can do on their own behalf, all the natural supports, some of which, again, they might have taken for granted, all the professional supports that are out there, all aligned in this community that builds on their own natural resources to help them out. So we planted through this a sense of optimism, a sense of possibility, and a sense of potential. And we've emphasized in a lot of ways going through this, all the reasons in which they don't want to die. So at that point, we talk about, since you can't avoid all suffering, since terrible things may happen to all of us, if there is a life circumstance which might evoke in you a sense of total despair and a lack of any understanding of how you can cope, if you have a gun handy and you use it, an attempt which minutes or seconds later you might have regretted. If you use a gun, 95% of the time you'll kill yourself. So now that you know that you don't always feel desperate, you don't always want to die, that there are other things that can happen in your life that promote your safety and security and your well-being, wouldn't it be great not to have a loaded gun handy on the odd chance that you might feel desperate in that millisecond and kill yourself? And so people are much more motivated to understand that. Once we go through how to make the environment safe, and it's not just looking at means of killing yourself, guns and pills and knives and sharps and the rest, but we're also looking at making your psychosocial environment safe too. Because if you have people who, when you're desperate, encourage you to self-harm, that's not a safe environment either. So that goes back to making good choices about healthy relationships and good choices about how to avoid and distance from dangerous relationships. That's all making the environment safe, physical and social. That all builds the sense of life is worth living because of, I don't want to abandon my pets. I have these people who do try to help me. I don't want to let them down, or I want to give them a chance, or they've shown me that they don't give up on me despite what I do. So just like I mentioned in Seeking Safety, where we say at the very end of it, what safe coping skill have you used? What have you taken away where you feel that life is worth living? That this is an aspect of life that you want to move forward to in a positive kind of way. You have some optimism, some hope for the future. So here's the safety plan template. What are some of those early or initial thoughts or feelings or behaviors that lead into suicidal thinking? Warning signs. What are some distractions that I can do by myself, on my own coping? Who can I call to help distract me or provide distraction? With a friend, coping. Who can I call for help? Tell someone. Who can I tell I'm feeling suicidal? Who can take me to the hospital? Practical support. Then professional agencies, therapist number, emergency number, on call, urgent care, hotlines, warm lines, text lines, and then making the environment safe. Sure, medicines are locked up, guns are removed, alcohol locked up, sharps. What is the most important thing I need to remember about why I should live? Reasons for living. That's where we end. And just like with seeking safety in everything, every step of the way, when we're talking about personal self-management and self-care and coping skills and safe coping skills, again, what intrigues them? What are they motivated to do? What will answer their concerns? What's relatively easy? What's something they can practice, unseen, unobserved by anybody, that they can kick in when they have the barest of warning signs, so it becomes a daily practice of self-care and self-nurturing. So now what we're going to do is go through that framework and align it with all the seeking safety modules that apply. So the person needs to be able to recognize warning signs, red flags of danger, green flags of safety and seeking safety. The clinician can go through the events leading up to, during, and after the last suicidal crisis or horrific re-experiencing of trauma. Help person identify when they should use their safety plan. So, red and green flags. Spiraling down, spiraling up. Warning signs are red flags. Red flags are messages of distress and danger, a reminder to attend to your self needs, right? So that's a warning sign by definition. Green flags, messages of safety and support, reminder to attend to self needs to stay safe. Again, a warning sign of this is what you want to practice: grounding and centering, soothing. So you can see how the very first step of safety planning is the very first step of seeking safety. And then the list, like we've talked about in red and green flags from seeking safety. Now we get to on my own coping. What's the very first module in seeking safety? Safety. What does safety mean to me? What are the vast array of safe coping skills? And like I've mentioned to you before, what I suggest to you, it's not in the manual, but you make a poster of the list of 80 plus safe coping skills. And whether it's individuals or people in a group, whenever somebody comes in with either a variation on the theme or a modification, or an out-of-the-box one that's really, really useful, add it to the list. So it's the collective wisdom of everybody who's worked with you for seeking safety, for embellishing safe coping skills. So these are meaningful acts that distract the person and make them feel better. If a person is able to cope on their own, even briefly, this increases self-efficacy and self-control. And you look at roadblocks again, challengers, barriers, right? To use these strategies and problem solve a way around them, not wanting to help yourself, feeling stuck, right? Feeling worthless can be a roadblock. And so that's where other activities come in that we'll talk about, right? So on my own coping strategies, distraction, soothing, physiological. We've talked about this. Again, distraction can be anything. It can be mindfulness kinds of exercises. It can be, I really endorse this. This is supported by the literature too. Even the most depleted people who feel that they have nothing to offer, if they can give some small thing to somebody else, they feel so much better about themselves. Just to have a small bit to offer, to volunteer in the smallest kind of way, makes you feel filled with the possibility that there is goodness within, there are assets, there are virtues, there are strengths that I have. Even trivial or small ones to me may be hugely important to someone else. And then mindless kinds of things like counting, and mindless in the sense of actually using your wise mind in DBT, ways of thinking about it, to not pull yourself into being sucked into all that negative energy. Soothing in all sorts of ways. And one of the ways that I've talked about with you before that you can use with young children is just a distraction of what's your favorite color, what's your favorite song, what's your favorite animal, and get them to think. And the thing about favorite is that this is personally significant to me. I have favorites, right? I have opinions. I have things that make me feel happy, right? As opposed to just, again, I'm nothing but immersed in trauma and despondency and victimization and abuse. There's other possibilities for me. And getting lost in, the cliche for a lot of people who are first learning about mindfulness is the thing of, peeling an orange and you smell the volatile oils and what that's like. You feel the oil on you when you're peeling it. You taste it, that sensation's like. So using any of the senses to be fully mindful of that, and you're immersed in those sensations as opposed to immersed in your trauma or immersed in your urges and cravings for drugs. Exercise, progressive muscle relaxation. And one thing that I mentioned to you that's really, really important is for a lot of these exercises, traditionally we talk to people about closing their eyes. Do not do that with anybody who has a semblance of a history of trauma, because they need to be vigilant against danger. And especially when they first meet us, the last thing we want to do is make them feel unsafe. So eyes wide open, take in the world, but take it in a neutral kind of way. And that comes from DBT and ACT as well, dialectical behavioral therapy and acceptance and commitment therapy, which is looking at all the things passing you neutrally, detached in a good way, where you don't metabolize all the reactivity, the fight and the flight, and the victimization that happens. So on my own coping and seeking safety, all those coping skills, huge array, right? Taking good care of yourself, self-care. If you don't take care of your basic needs, not your wants, but your basic needs, food insecurity, clothing, supportive housing, your shelter, medical needs, medical care, parent needs, childcare needs, on and on we go. If you don't take care of those, and as you remember in seeking safety, what you want to see is that recovery is a basic need, right? Detaching from emotional pain, grounding and centering, mental, physical, and soothing, and a commitment, keeping promises to yourself and to other people. Again, bolsters your own sense of yourself. So here's a review again of those modules: safety and safe coping skills, detaching from emotional pain, grounding and centering, to shift attention towards the external world, away from negative feelings, detaching from emotional pain, centering, looking outward. Can be done at any time, anywhere. Practice frequently, and like I said, always keep your eyes open. Those are on my own in safety plan terms, and seeking safety terms, safe coping skills. That's where we start. After the warning signs: mental grounding, physical grounding, soothing grounding. Like we talked about, they'll all be helpful to people at different points in time. Some people will favor one category over the other. Some people like affirmations and visualizations, safe places, coping statements, affirmations. Some people like mental grounding, which is saying a safety statement, describing the environment in detail, and physical grounding I find really helpful for people, even people who are experiencing florid psychotic symptoms like hallucinations and delusions, or people who are on the cusp of dissociation and derealization and depersonalization, to feel the ground beneath you, to feel whether or not your skin is warm or hot, to feel the texture of your clothing, to look outside through the window and just be able to list, what kind of trees they are, what kind of birds they are, what are you hearing, what are you attending to, pulls you out of all of that. And I talked about this soothing grounding exercise with favorites just minutes ago. Then we moved to step 3. So step 1, warning signs. Step 2, on my own, with a friend coping. Socialization for meaning, for distraction. Healthy environment. Don't go to a bar if you're an alcoholic. Go someplace else. Seek support from family, friends, and acquaintances who further your path towards a future filled with reasons for living, meaning, purpose, value. Never rely on just one person, okay? Think of all the other possibilities. Role play, like as always. Tell someone coping. The reason we're moving through these is with a friend, tell someone, and professionals all have a core of seeking safety skills and topics and modules that apply as a group. So we talk about step 4, tell someone, that's friends and family, acquaintances who would be helpful in giving you guidance and counseling to help you resolve that crisis, who help you problem solve, who help you brainstorm, who are good at looking at alternatives, who have optimism about the future and your future, who value the idea of taking small, incremental steps that lead to another. Not people who are pessimistic about the future or feel that if you're traumatized, you're forever stuck. Or if you've had a difficult or horrific childhood, that your possibilities in the future are massively limited. You want people not to be overly optimistic and unrealistic, but realistically looking into a future that's brighter. And then professional agencies, like we've talked about. So what do these all have in common? What are the skills that you need? How to ask for help, how to identify somebody who endangers you, who promotes your safety, how to ask for help in a way that's easy for them to do it and makes you both feel good about the process. So that would be someone who, for instance, I've given this example many times, but if you're in a seeking safety group for the first time and people have distributed a handout and you don't see copies lying around, you have to share the handout. That's a pretty easy ask for anybody, but that's very different from you're leaving the group together and you tell somebody that you've been acutely suicidal for most of the last month and you have no friends, and can you call on them when you're about to make an attempt so they can help you avert it. Now, you might find somebody who's interested in doing that, but it's a very big ask for a perfect stranger. And you don't even know if that person is somebody who wants to be helpful or can be helpful. Or if you call them, will respond by admonishing you or making you feel bad or rejecting you or saying that you're way out of line. So asking for help is really critical to move on. And how do you do that? A lot of people, they're given the number for a hotline, they don't know what to expect. They don't know how to advocate for themselves, or they spill out their story in great detail of trauma and victimization, and they re-experience in the moment, and they overwhelm the other person, and it just furthers anyone's sense of themselves, as well as their own sense of themselves, that all they are is a bucket of misery, and that they're hopeless, and they're looking to somebody else to solve all their problems. So asking for help is a critical skill. Then getting others to support your therapy. Who again do you embrace? Who do you open up to? You don't want to show all your vulnerabilities to somebody who will take advantage of them and manipulate you, further abuse you, or help you pursue a course to self-destruction. So finding others to support your recovery is intertwined with who to ask for help from, and what does a healthy relationship look like versus a dangerous one. They're all connected. What are all the community resources to aid your recovery that are out there? Like I talked about, housing and shelter and supported employment and food banks and all the ways in which you can deal with basic needs, they're all out there. Making a commitment, keeping promises to yourself and to others. That engenders trust and compassion in yourself and in other people. If you make empty promises or promises that you can't keep, you'll be disappointed in yourself and disappointed with them. Coping with precipitants and activating factors is how to change people, places, and things. And I'm going to go over that in a little bit more detail right now. And then respecting your time is really important. You know, if you have limited time, and like we know, as an example, how do we define substance abuse versus substance use? Spending all of your time and energy using the substance, securing the substance, making sure you have an ongoing supply of whatever drug that you're using, all your energies and all your time are put into using substances which enhance your harm, as opposed to respecting your time to take care of your needs, to give the time to yourself to nurture self-compassion and self-care, to learn how to open yourself up to gradually, judiciously, cautiously, but wisely, to other people who promote your recovery. So here's all the information about asking for help, healthy relationships, making and keeping commitments. And then this is what I wanted to emphasize again. Reaching out towards safe people. You can make that choice. Again, agency, self-control. You can participate in activities that prevent self-destructive behavior. Physical exercise, grabbing and centering, watching a fun movie, taking up a hobby, walking a pet or taking care of a pet. And where? Place yourself in a safe, healthy environment. And then making the environment safe, right? I gave you the rationale again for why we do that towards the end. Lethal means counseling again. The most effective means for reducing suicide is to reduce and remove any lethal means from the home. Reducing access to lethal means can determine whether a person at risk for suicide lives or dies. Puts time and distance between a suicidal person and higher lethal means. If we do that, a life can be saved. And again, do not believe that the presence of lethal means in the home is unknown. Lethal means restriction works because we reduce suicide attempts, we delay them, because there's nothing around that is going to result in death, or it's less likely to result in death because you're looking at, for instance, overdose, like we've talked about. With firearms, 95% who use firearms in a suicide attempt die. For overdose, 2% die. 98% survive. So even if there's substances around, it's much less likely than a gun. And so you can see that making the environment safe by setting boundaries in relationships, is also critical. Because if you have people who give you guns or give you lethal drugs like fentanyl, that is going to make your environment unsafe and make it more likely that you'll suicide. And then you end with looking at reasons for living. So this is sort of the pulling together, seeking safety and safety planning. You'll get the PDF. I'm more than happy to hear from you. Thanks for being with me. I apologize that I need to leave a few minutes early because I'm doing a 10 o'clock training on another subject with a bunch of other folks. Thanks so much for joining me today. And as a reminder, again, I'm presenting at Grand Rounds at 1 o'clock on Friday. So you're more than welcome to attend, and please encourage all your colleagues and friends to join us in that discussion. It won't be referencing seeking safety per se, but it'll be a significant review for a lot of folks about safety planning in this co-created, collaborative, strength-based, solution-focused kind of way. Be well, and I hope to see you and hear from you soon.